Good morning, students. This is Dr. Green, Nursing Research Online. This is a Integrity presentation on Chapter 13, Building an Evidence-Based Nursing Practice. This Integrity presentation will be used for both weeks 14 and 15. These are our learning objectives. Identify the benefits and barriers related to evidence-based practice in nursing, critically appraise systematic reviews, meta-analyses, meta-syntheses, and mixed methods systematic reviews of current research evidence. Use the PICOT format to formulate clinical questions to identify evidence for use in practice. Describe the models used to promote evidence-based practice. Apply the Iowa model of evidence-based practice in implementing evidence-based changes in your practice. Implement research-based protocols, algorithms, and policies in your practice. Describe the significance of evidence-based practice centers and translational research in developing evidence-based healthcare. I assume you're practicing nurses, so I assume that you know a lot about evidence-based practice, but we will start with a definition of EBP. So evidence-based practice is the conscientious integration of best research evidence with clinical expertise and patient values and needs in the delivery of high-quality, cost-effective healthcare. The focus of evidence-based practice is broader than pure research. The goal is to implement high-quality, cost-effective care to promote positive outcomes. And those outcomes are measured by the following. If we have high-quality, cost-effective care, we will have less variation in the way procedures are enacted, eliminate unsafe practices, improve survival rates, and decrease complication rates, particularly infections, decreased critical incidents, length of stay, and litigation. It requires research evidence, clinical expertise, and acknowledgement of the patient's values and needs. There are many resources for you to look for evidence-based resources. Table 13-1 in your textbook mentions a number. Here are a few. CINAHL, which you should be pretty familiar with by now, Medline, and Cancer Lit, the Cochrane Library and the Cochrane Nursing Field, the Joanna Briggs Institute from Australia, the National Guideline Clearinghouse, and AHRQ, Agency for Healthcare Quality and Research. Some of the barriers to implementing evidence-based practice are practical or conceptual and common everyday attitudes. So some of the practical barriers are there is a limited support for evidence-based practice from administration in certain agencies. Minimal rewards for discovering and offering evidence-based practice care to patients and families. Conceptually, at this point, there is insufficient evidence to support nursing interventions, many nursing interventions. And the fear is that using evidence-based practice will create a cookbook approach to care. And that could happen if implementation of guidelines is not thoughtful and it requires expertise and good judgment to implement evidence-based practice. Let's see. Benefits. Improved outcomes for patients, providers, and agencies. It leads to best treatment or the gold standard. And it's an integral part of the magnet status process. So many hospitals are trying to be awarded magnet status. and magnet status is awarded by the American Nurses Credentialing Center. And a good portion of their decision is based on the degree to which an agency supports evidence-based practice. What are some of the sources for evidence-based practice? Well, the best evidence research is produced by the conduct of and the synthesis of numerous high-quality studies in health-related areas. And these are examples of best evidence. If you see the word systematic review or meta-analyses or integrative reviews or meta-summaries or meta-syntheses, this would be a good indication that you have a reliable source for making decisions about perhaps changing a policy or a protocol. So what are integrative reviews? They identify, analyze, and synthesize results from independent quantitative and qualitative studies to determine current knowledge. They include multiple levels of research designs and literature types. And it's a complicated review, but it gives breadth and depth to conclusions. And you would want to look at the journal, the Annual Review of Nursing Research. This does publish integrative reviews. How do quality integrative reviews contribute to evidence-based practice? They identify and refine questions and outcomes, identify types of participants and interventions. They augment and provide data for research synthesis. They highlight inadequacies in methods. They explain findings and interpretation of findings, and they help make recommendations. Research utilization involves which of the following? Research utilization: communication of research findings, observing outcomes from changing practice, use of knowledge in practice, or all of the above. I hope that you would pick D, all of the above. Another term that you need to know is systematic review. And a systematic review is a narrowly focused synthesis of research findings from quantitative studies. It looks at the studies that have a similar methodology or research design and has the same standards of clarity, rigor, and replication as primary research studies. It involves identifying, locating, appraising, and synthesizing quality research evidence for expert clinicians to use to promote evidence-based practice. What are the steps involved in systematic reviews? First is to formulate the purpose and identify the scope of the review, develop specific questions or hypotheses, establish criteria for inclusion and exclusion of certain studies, and conduct an extensive literature search of all sources. This is the reference is Melnick and Feinout, Overholt, 2010, and Whitmore, 2005. Melnick and Feinout, Overholt, those two authors, you often see their names when articles talk about evidence-based practice in nursing. What steps are involved in systematic reviews? Here is a forest plot. This shows the individual randomized controlled trials and overall pooled estimate from the 7 original randomized controlled trials with a high quality score addressing the impact of mammography screening on breast cancer mortality in women 39 to 49 years old. And this comes from the Journal of Women's Health in 2011. Okay. What is a meta-analysis? It statistically pools results from 2 or more previous studies into a single quantitative analysis. It provides one of the highest levels of evidence about effectiveness of an intervention. So a statistical analysis carried out to integrate and synthesize findings from completed studies to determine what is known and not known about a particular research area. And it allows for application of scientific criteria. For example, they have the correct sample size, what's the level of significance, what are the variables studied. This is a flowchart on the effectiveness of intervention programs in preventing falls, a systematic review of recent 10 years and meta-analysis. So they looked at the titles and abstracts by doing an electronic search, and they came up with 17,325 titles. And titles and abstracts unlikely to be relevant were excluded. That brought the number down to 15,419. And studies that did not identify randomized controlled trials were excluded, and that brought the number down to 1,619. So the potentially relevant studies were reviewed. Studies that included children falls were excluded. Study duplicates were excluded. Potentially relevant studies were reviewed, 227. And you see how they're culling it, right? They're trying to remove studies that are not focused on their question. Studies that did not report fall intervention or effectiveness of the program were excluded. Studies that identified unclear intervention period or did not meet the intervention period and quasi-experimental designs were excluded. That was another 40. Studies that did not include both men and women were excluded. That removed 15. Now, potentially relevant studies were reviewed, and of 21. Remember, we started out with 17,000, right? Studies completed with unreliable follow-up were excluded, and there were 4 of those. That brought the N down to 17. So the final studies included in the meta-analysis were 17. What results are reported in a meta-analysis? A large, diverse sample that is more representative of a target, the target population. There's a determination of the overall significance of the probability of the pooled data. There's an indication of the efficacy of the intervention from average effect size determined from several quality studies, and the strength of the relationship between variables is noted. What's a metasynthesis? It's a systematic compilation and integration of qualitative study results. So metasynthesis, think qualitative studies. Meta-summaries. This is a term that's not used a whole lot, but you need to be aware of it. It's a synthesis of multiple primary qualitative studies to produce a narrative about a selected phenomenon. We have talked a number of times about the concept of hope in elderly patients, or the concept of sorrow in multiple sclerosis patients. So they would be, if they're interested in that, a meta-summary would look at multiple primary qualitative studies to produce a narrative about a selected phenomenon. So it expands our knowledge base beyond one study to several studies. How do you determine the best evidence for use in practice? The strength of the evidence is on a continuum from high quality results to lower quality results. Evidence-based guidelines are essential in developing evidence-based practice for nursing. Which of the following has not been identified as a barrier to using research knowledge in nursing practice? Findings are communicated primarily to other researchers? No. Studies have adequate replication? That's a possibility. Practitioners often do not value research? Researcher-originated studies often do not solve pressing clinical problems. Well, B, nursing studies have adequate replication. That is really not true. That is not a barrier. What is the difference between strong and weak evidence? In terms of intervention studies, okay, we're talking about quantitative studies, not qualitative. The strongest evidence is produced by meta-analysis, integrative reviews, and experimental studies. And the weakest evidence, I would say the weaker evidence, comes from descriptive surveys, qualitative studies, correlational studies, and quasi-experimental studies. What are the phases in the Stetler model of research utilization? There are 5 phases. Phase 1 is preparation phase. And this is where the researcher will search for, access, and organize pertinent literature. Phase 2 in the Stetler model of research utilization is validation. In this phase 2, the researcher will appraise research reports for quality. If there are none, they stop the process. If quality reports exist, they may decide to use the recommendations in practice. Phase 3 is comparative evaluation decision making. The researcher or the research team or the nursing unit team finds sufficient evidence existing. They examine the positive and negative forces in the agency, forces that would encourage or discourage implementation of a particular practice based on research, and they ask whether or not research-supported interventions are already in place. Phase 4 is translation or application. Plans are made to implement research-based evidence in practice. And they do that through continuing education for nurses on unit. And it may lead to changing policies or protocols, or garnering further support for current policies or protocols. And phase 5 is evaluation. The impact of the change would have to be assessed on all levels: patient, staff, agency. This is a diagram of the parts of the Stetler model. This model can be found in Nursing Outlook Journal, 2001. So here are the phases across the top. Phase 1, looking at the evidence. Phase 2, validation. Phase 3, comparative evaluation. Phase 4, translation. And 5, evaluation. Excuse me, this There we are. Okay, so this is the Stetler model. Another important model that you need to know about for evidence-based practice is the Iowa model of evidence-based practice. The University of Iowa, the College of Nursing, is very research-oriented and is particularly interested in demonstrating the effectiveness of nursing interventions. They provide direction for the development of evidence-based practice in an agency. An interesting note, the Iowa model is management-centered. That's something to keep in mind. And I think they see management as a driver of change. So if evidence exists, then one develops a research-based protocol followed by pilot testing, and if that works out, then possible adoption. For those who are working with the Iowa model, they look for triggers for change in the hospital environment. So they look at risk management data, they look at financial data, organizational standards, and philosophy of care. Here is the Iowa model in flowchart form. I'm not going to go through every part of this, but I suggest that you take a look at that, particularly if you're a member of the Quality Assurance Committee at your agency. So what questions would apply to the Iowa model? What are some effective strategies for implementation? What are outcomes from using the research findings? Do the data support the change? Is the proposed change an agency priority? You see how management is prominent here? Now, another model for implementing evidence-based practice is called the GROVE model, G-R-O-V-E, where nurses identify a practice problem, and they search for the best research evidence to manage the problem in their practice. And they look for evidence-based guidelines to see if one has already been developed. Nurses will critically appraise the authors of the guideline, the significance of the healthcare problem, the strength of the research evidence, the link to national standards, and cost effectiveness of using the guideline in practice. This is the GROVE model. This is rather new, 2015. So here we have nurses see a practice problem, they search for the best evidence, they look at the evidence-based guidelines, and then they appraise the authors, the significance, the strength of the evidence, the link to standards, and cost effectiveness. They may decide to integrate the evidence-based guideline with clinical practice. They look at the use of the evidence-based guideline in practice from the point of view of the patient, the provider, and the healthcare agency. They monitor outcomes from the use of the evidence-based guideline, the outcomes for the patient, the provider, and the healthcare agency. Then they may refine the evidence-based guideline, and then they put the evidence-based research guideline into practice. And that can actually come back again to looking at the practice problem to see if there is an improvement in patient outcomes and quality. So what factors would you consider in instituting a practice change? Is there a practice change that you want to implement? Some questions are, will the implementation take a long time? What support is needed to make the change? Are there barriers to instituting the change in practice? What barriers may exist to prevent utilization? Well, there are administrative barriers that may have to be overcome. One barrier that research may not be valued. A limited change in the agency or change is not based on research. Limited resources to make research-based change. Clinician barriers. Some clinicians do not read research reports. There are a number of nurses who have really not been exposed to a research course the way you have. So they don't read the research. A lack of education about the research process. And not just the research process, but the research process in the practice setting. Some people don't believe research findings. They do not know how to implement the findings. What factors should you consider when monitoring outcomes? After the change is effected, the outcomes must be monitored for effectiveness. Okay, that's where you need a quality assurance committee. The change should be documented regarding improved quality of care, decreased costs, saving nursing time, and improved access to care. So feedback is needed. What does the acronym PICOT mean? So I think that you know that P stands for population or participant, I stands for intervention needed for practice, C stands for comparison of interventions to determine best practice, O stands for outcomes needed for practice, and T stands for timing. How are guidelines developed for evidence-based practice? Agency for Healthcare Research and Qualities helps with guidelines through the development of an expert panel. The group designates the scope of the guidelines, they synthesize the findings to develop recommendations for practice, and the guidelines are developed, are presented at meetings and published. What are a few examples of AHRQ practice guidelines? Guidelines for pain management, decubitus prediction and prevention, cataract treatment in adults, depression treatment, screening, diagnosis, management of sickle cell disease in newborns and infants, otitis media treatment in children, and the availability of cardiac rehabilitative services. Development of evidence-based practice guidelines is a major focus of Agency for Healthcare Research and Quality, Agency for Nursing Innovation, Best Practices Forum for Healthcare Providers, International Clearinghouse for Research Findings. The answer is A, AHRQ. Access to evidence-based guidelines, the Agency for Healthcare Research and Quality, National Guideline Clearinghouse, the Academic Center for Evidence-Based Nursing, the American College of Physicians, and the American Academy of Pediatrics. How does the nurse implement evidence-based models? They identify a practice problem, they search for best research evidence, and they determine the quality of the guideline by assessing these 5 items. What is translational research? This is an evolving concept defined by NIH as the translation of basic scientific discoveries into practical application. It's encouraged by nursing and medicine to increase the implementation of evidence-based interventions in practice and determine if these interventions are effective. A good example of research coming out of a center is the Iowa Center for Nursing Research. This concludes the presentation for Chapter 13. You will find the PowerPoints posted on Blackboard, and I ask you to download those and view this integrity presentation. Thank you very much. Contact me if you have any questions on building evidence-based nursing practice.